And I will be speaker in this session about the combined use of PRP, platelet-rich plasma, and human follicle stem cells in hair regrowth, and also with a second speech about the potential use of fat grafting enriched with adipose-derived stem cells in breast augmentation.
have a live demo in the same session. The question. Okay, you are here, so I will. Okay, for the microphone. Andy. Hola, Albert. Estem com el saló de casa. Sí, a aquesta hora. Sí, sí, és un... Ho han agafat els de Tosca, no, ho vaig veure ahir, perquè a part que els conec de Caldes, aquests els de Tosca. Avui està. Comencem amb 8 segons. Ok. Hello, thank you for coming. Today I'm going to talk about dyschromias, the science and settings, the right expectations and application. Let me introduce myself. I am Dr. Beatriz Beltran. I am aesthetic doctor from Barcelona, and I would like to share with you my experience using a SkinPen, and it makes a change in my understanding to improve the quality of the skin in my patients. SkinPen is microneedling. It has 6 indications, and it has the FDA cleared for acne scars in face and fine lines and wrinkles in neck. In Europe, it has the CE mark, also Australia, New Zealand, and Hong Kong for acne scars in face and fine lines and wrinkles, face and neck, and also pigmentary disorders like hyperpigmentations like melasma, solar lentiginous, and vitiligo. Just you have to ask the distributors the specific indications in your country. For having good results with a SkinPen, it's mandatory to understand 2 things: to know the anatomy and to understand the depth of the skin. Let me make a reminder of the anatomy. As you well know, the skin has 3 layers: epidermis, dermis, and hypodermis. If we are interested just in 2 layers, because a SkinPen arrives just the epidermis and the dermis. Let me explain the dermis. The dermis is the middle layer of the skin that it gives the elasticity of the skin, and in this layer we can find the vessels and also the hair follicles. And in this layer there are 2 parts. The superficial part is the papillar dermis, where are the is the thin fibers of collagen, and in reticular dermis, just in the bottom, we can find the intertwined fibers of collagen. And here, if we are talking about epidermis, there are two cells that are very important to understand where are placed if we want to achieve a good result with a skin pen. Keratinocytes and melanocytes. Melanocytes are the cells that are responsible for the pigment formation, and they are based just in the bottom of the epidermis, just above the basal membrane. And keratinocytes are the more common cells in the epidermis, and the time that it takes the keratinocytes go to the bottom, to the top of the epidermis, it can take 30 minutes. It is very important to understand the depth of the skin if we want to achieve a good results. The depth of the skin, it can have variations. It depends of the gender, the race, age, and also the body mass index. And the thickness of the skin just around the eyes, this is the thinner part of the skin in the face, and in the cheek is the thicker part of the face, is the thicker depth of the face. It's very important to understand, because when we are going to decide which depth I have to choose for the skin pen treatment, it is mandatory. Don't worry, because during this presentation we have two parts. We have a theoretically part, and secondly, we have a live demo that you can see a real patient, and you can see how we can perform this treatment very safe, because this is skin pen is a very safe treatment that we can delegate without any problem to our staff. And we are going to talk much better further during the live demonstrations about the depth procedures of the skin pen. And if we are talking about dyschromias, it is important to know that there are two types of dyschromias. The hyperpigmentation, that it is an overproduction of pigment, and we have two lesions like melasma and solar lentitions. And the hypopigmentation, it is due the loss of melanin in that area, and we have the vitiligo. It's very important to understand how the skin is pigmented and where it takes place. Let me show that here you can see that the melanocyte just is in the base of the membrane, and the basal membrane, and one melanocyte, it is a relationship between melanocytes and keratinocytes. One melanocyte has approximately 30 or 40 keratinocytes connected to a single melanocyte. This is, it calls a unit, and it is very important to understand, because if we understand this part, we'll understand the concept of the treatment, and because the results that I have with dyschromias using this treatment. And the anatomical, it helps to understand that when we are treating pigmentary problems, when we are treating pigmentary disorders, it's necessary to be in the epidermis. And when we want to treat the damaged collagen or elastin, it's necessary to be in the dermis. For this reason, it's important to understand this anatomy and the depth of the skin. Here we have that the depth of the epidermis just in the face, it is from 0.25, 0.50, and in body 0.25, 1 millimeters. This is very important to address the depth variations and to target needle depth to require the area to treat. In melasma, we will know very well that this is a very common problem that we suffer a lot of, especially women in Mediterranean countries and around the world, and is more common in races with a higher pigmentation, and that can occur in all types of skin. The pathogenesis of melasma is not clear, but it is associated with solar and hormonally stimulate melanocytes. And here we can see this patient with a melasma, and melasma can be darker or can be a light brown. And in this slide, we can see a normal pigmentation. Okay. You can see a normal pigmentation, and here we can see the darker region of melasma, that here there is an overproduction of melanin due to the melanocytes, and we can have darker region if we have more concentration of melanin, and light region of melasma when we have less concentration of melanin. The solar lentigens is a problem that due to an excessive production of melanin pigment for sun damage. If we have an overexposure of sun, we will have this problem. Okay, that we can treat these solar lentigens with other techniques like lasers, but it is very important understand that this technique, it can help also in those patients that they have a higher phototype, and I can do light devices because I can have I don't want to have a hyperpigmentation reaction after the treatment. The mechanism of actions, for treating the hyperpigmentation of melasma, I'm going to explain in this slide, because when we are using the microneedling, as you well know, for treating melasma, we have different options. But if we want to treat with microneedling, it's important to understand that we are using a non-inflammatory path. When we use other techniques like lasers or peelings, we are using an inflammatory path. And sometimes we want to use a non-inflammatory path in some patients that they can have more hyperpigmentation reactions after those treatments. So this is a very good indication. And I just, in my country, I live in Spain. You know that in Spain there is a lot of sun damage, and I have a lot of patients with melasma. And during the summer, I can do procedures that can control the melasma. And these procedures, it helps me a lot to control the melasma during that time that I can do other procedures. That's the mechanism of action of microneedling is a non-inflammatory path, because I do a microchannel in the epidermis, and with this microchannel, I'm trying to induce to the increase the turnover of the keratinocytes. Remember that keratinocytes, the unit with keratinocytes and melanocytes is one melanocyte has 30 or 40 keratinocytes. If I increase the turnover of keratinocytes, I can release the keratinocytes that are more pigmented, and I can replace those keratinocytes for keratinocytes with less pigment. This is one of the mechanisms of action, and it's not necessary to add other treatments. Of course, if you treat with creams, and you can have a better results, but just this is the mechanism of action, only doing this. And also, we have to reach just the layer that where are the melanocytes. So the treatment should be very shallow, and this is the point that we need to do. And also, with microneedling, the studies shows that induce a response in the gound response to create a change of the stimuli to create more melanin in the melanocytes. So there are these two types of actions to solve the melanin. And for this reason, I like to have a SkinPen, because when we want to reach the basal layer, it's very important the precision of the device, because if we don't have a precise device, we don't know exactly which is the depth that we have to treat. And this study is the only microneedling that it has the study of this precision. We can see that when we choose a depth, we are doing that depth. And in this study, we can see that if we choose the depth of 2, we are in the 2 millimeters. And if we compare with other devices, this is the more precise devices. For this reason, if I want to achieve a successful result, it's necessary to make sure that we are in the layer that we want, and the device should be very precise to be just in the depth that I want to treat. Here, there is the results of the study of Dr. Sattler that also improve the solar lentigens using the microneedling. Honestly, I use lasers for this kind of lesions, but there are some patients that I can do lasers, because the damage that I do in the epidermis with a laser is higher, and sometimes I don't want to have those damage, so I have an option to do this treatment with this. And the results, the satisfaction results are very good. The procedure for treating the hyperpigmentation should be very shallow, because melanocytes are found at the bottom of the epidermis, just at the top of the dermis. And the needle depth should be 0.5, and it depends of the area of the face, but not more than this depth. You will see during the live demonstration, and we'll have more time to discuss this. I recommend, when I'm treating dyschromias, treat every 2 weeks instead of every 4 weeks that I usually do for treating the improving collagen and improving the acne scars. Why? Because I want improve and increase the turnover of the keratinocytes. And this is very important. And if I do every 2 weeks for treatments, I have faster results and better results, but I increase the turnover of keratinocytes. And typically, I recommend always at least 4 treatments if I want to have a good result. And of course, you can combine with cosmetic creams to help to reduce the pigmentation, and of course, the sunblock. How do I have to treat the area? It is very important. The treatment should be very shallow, and we need to do 3 paces. We'll see during the live demo, but I like to do one vertical pace, another horizontal pace, and then another pace, making rounds movements. And if I have an area more pigmented, I can round more in that area. Finally, as we are treating very shallow, the redness, it is not too much, because we're not reach just the epidermis. But you will see just after the demo how is the patient. Here I have a video that you can see how I treat the. In this case, we start. Remember, we are very shallow. In this case, 0.25, maximum 0.50 It's very important. And we make one pass in horizontal position, and it's very easy. And if you don't work with SkinPen, the first time that you work with it, it's very easy because it is very ergonomic. The second pass is totally vertically and very shallow because we are interested to be just in the dermis. If our aim should be to treat acne scars, then we have to go deeper. Or, for example, if I'm going to a body regions that we can treat, then it's necessary to know the depth in those areas. We can see just in the live demo much better, and we have more time. And here, and then the last pass, I make round movements, and if I have an lentition in that area, I can insist to trying to improve a little bit more. Just the results with only one treatment in one session. Just let me explain my personal, in my personal practice, I have a lot of patients with melasma that I treat with different treatments, but what happens when arrives the summer? Everything is a disaster, but increase the melasma. You have to stop all the creams that are strong for treating this problem, and you don't have other options. This is amazing way to maintain these patients with a good results and to help to reduce the pigmentations in those areas. Here you can see the results just after one treatment, 10 days after the session. And let me finish explaining that in vitiligo there are studies that it shows the improvement in this pigmentary disorder. I want to be honest with you, I don't have experience with vitiligo in my practice, but I think that it is very interesting because, as you well know very well, there are not any specific effective treatments for this disorder, so if it can help, it is very important. The vitiligo, you know that it is why there is a loss of melanin or the melanocytes die in some areas, and for this reason the patients have a white patch in the skin of the face or in the body also. And the mechanism of action of for improving the melanin inside the melanocytes, it is that if we are treating just the border of the vitiligo, we can stimulate the migration of the melanocytes from the pigment areas to the unpigment areas. And also, it's very important induce a stimulation, just the microneedle, the microchannels, induce a stimulation of the response of the normal wound healing, resulting in the activation of blood platelets that release growth factors and may reactivate melanocytes to make more pigment. And this is the studies shows the increase of the hyperpigmentations in the vitiligo areas, and the treatment should be very shallow also because we have to treat the melanocytes, and the needle depth should be the same level like melasma, and we recommend to treat every 2 weeks, and it is very important to cover the area through multiple passes and start just in the border from outward toward inner part of the lesion. It is very important. It's necessary to do at least 10 treatments every 2 weeks, and here that we can see that if we treat in the border, we have more pigmentation in the cells. This is my contact. Just in case that you need something, you can contact me. And if you want to ask me some questions, we can do now. But if you want, during this time, we can connect with a live demo. And in the live demo, we are preparing a patient. She's in her 60. The treatment will be performed by my nurse. My nurse is my sister also. And I like very much this treatment because it is a treatment that you can delegate to your staff in a very safety way. Because if you train your staff and you have to explain to them the different, they have to understand the depth they want to treat. It's very safe and very easy, and it's not necessary to do yourself. And you can do other treatments and increase your business. I don't know if you have any questions during this time that we are connecting from both cells. One moment, because it's recording, if it's possible with micro.
What serums are you using when microneedling?
It's not necessary to use any serum because the concept of microneedling is to reach the melanocytes. So if you reach the melanocytes, you increase the turnover of the keratinocytes in the different layers. So with SkinPen, you do 1,600 microchannels per second, and after one treatment, you have more than 3 million of microchannels in face, neck, and décolléte if you treat. And it's not necessary to to put any cream. Or during the treatment, you put only a cream that is a sterile cream that it contains water. It's not necessary to do this because we are, as I explained during the presentation, we are treating in non-inflammatory path. There are different ways to treat melasma, but if we are treating in non-inflammatory ways, sometimes it's necessary because there are, if we use the inflammatory ways, just introduce products that are inflammatory, it can increase the risk of hyperpigmentation. So it's only a mechanical process. I don't know if I answer your question.
Thank you.
Thank you. What do you think about Koebner phenomenon for vitiligo?
Sorry?
Koebner phenomenon. Do you know mechanical irritation may cause
Yes,
Koebner
phenomenon? Koebner. I don't have, during my practice, I have this device from 2019, and I use a lot. I use also in patients. Just in my case, I am a patient that I had psoriasis. This is more common for have the Koebner effect. And I don't see this effect in my practice, but I think that just we are treating, for the melasma, for example, we are treating very shallow. So I think it's the mechanism of action. But just from my personal experience in my practice, I treat patients with psoriasis, and I don't have this effect. Okay. Here we have the patient, and I would like to explain how it works, the microneedling. The microneedling SkinPen, it is used, you have a kit, one only use kit, that in the kit it contains the cartridge. The cartridge has 14 stainless needles that are very sharp, and this cartridge it's only one use, and these needles works during 80 minutes. The treatment, we can start the treatment, and I am explaining. And in the kit also we have a plastic disposable that it cover all the SkinPen, and it helps to reduce the cross-contamination. It is very important because we don't have problems of cross-contamination. And the needles, we change every treatment, and here we can see the treatment, but you introduce the cartridge just in the pen. If you can do the treatment during 80 minutes, and the needles maintain the same sharp during all this time. And here, just in the top, you can move the depth, and as I explained earlier, just the depth you can move, and it is very precise, because when you choose one depth, you are in that depth. The depth goes from 0.25 from up to 2.5 millimeters. So we have different depths that we can choose, and it is very easy. Just in this case, as we want to treat dyschromias, we choose the 0.25, 0.5 in the face, okay? Because it's not necessary go deeper. Just in case that I wanted to treat acne scars or fine wrinkles, I need to reach the dermis. So there are, here you can see that it is very important to use the non-dominant hand to open and to strengthen the skin, and then with the other hand we can move with the 3 passes, okay? After the 3 passes, we can have a little bit of redness. It depends of the depth. We have more redness or less redness, but just for the treating of the dyschromias, it's not necessary to be very deep, so it's not, sometimes it's a uniform redness in all the skin. Now in this part we are treating the cheeks. The cheeks are the area that we can put the 0.5, and it depends of the thickness of the skin, maybe 0.75 for treating dyschromias. If I want to treat acne scars, or if I want to treat to damaged tissue, I need to go a little bit deeper. The area that I have to take care in the face, maximum 0.25, is the area around the eyes. For example, the thickness of the skin in the area of the forehead and the temples if I want to treat dyschromias in that area, I recommend to reach until 0.5. But if I want to treat acne scars or fine wrinkles, I can go until 1 millimeter in that area without any problems. When I'm going to treat acne scars, I'm more aggressive with the treatment. I'm going more deep. Here, in this area, we have to take care because this is a very thin skin, and for treating dyschromias, 0.25, and for treating the acne or fine wrinkles, until 1 millimeter we can do. You have any question? You can see that, and it is very important that the SkinPen has the same speed during all the treatment, and it's very important because it gives the better precision of the depth that we want to reach. And it's when you use this device, you can feel that the movements are quite homogeneous during all the time. Another thing that I consider very interesting, here we are treating the area just under the nose. We're treating all the face. And another thing that it is very interesting, that when you are using this device, you don't have a cord, because sometimes you need to connect, and this is a cordless device, and it helps to make much better the movement of your treatment. It is more ergonomic, and sometimes if you want to be sterile in the area, if you have a cord, sometimes you can have cross-contamination, and it is very safe to avoid cross-contamination due to the plastic disposable, and also you don't have cord, and it's very the use, it is very intuitive, because here you can see the blue lights. The blue lights are the charge of the device, but you can there is an inductive charging device that you can have just in your table, and you can put just the device on this area, and if you take it out after 30 minutes, the device starts to beeping. So and the battery lasts 8 hours without battery. So it's a device that you can bring in the clinic, and it's very easy. More things. I think that the needles are high quality, and these needles you can have the same precision of the microchannels in all the area that you treat during 80 minutes, and the studies shows this, and in your practice you can do it, and you can see that during all the treatment you have the same microchannels in all the areas that you treat. More things about it. Do you have more questions? Would you like to? Just in case that, for example, I use SkinPen. When I introduce a SkinPen in my practice, I'm aesthetic doctor, and I'm practice non-surgical procedures. We are experts in treatments without surgery. And for us, improving, of course, the wrinkles are very important, but I realized that if we do nice treatments, but if you don't improve the quality of the skin, finally you don't have the good results. So it is very important. And a SkinPen, it's a treatment that you can do in all patients, because there are some patients that they don't want to do a laser, or there are some patients that they have a higher phototype, and sometimes you are scared to do a laser or a procedure that can damage or can injure the epidermis and can have hyperpigmentary reactions after the treatment. Of course, I combine treatments. I combine lasers, I combine peelings, but sometimes you need this kind of things. And for treating acne scars, I love it because the results are amazing. I have also lasers that treat acne scars, but sometimes I prefer that way because this is, as I told you, non-inflammatory path, and is a treatment that the patients can do normal life. Sometimes when I do an ablat and fractional laser, if I want to be very aggressive, I have downtime. With this treatment, just after the treatment, you have redness during few hours, and the day after the treatment, you can do normal life. It is very important to understand that we do 1,600 microchannels per second. So after one treatment, we have millions of microchannels in the area that we treat. So it's very important to take care about it because the skin lost a lot of water because there is a loss of water transepidermal in the epidermis. So it's very important to maintain very well hydrated the skin. I recommend to drink water, and after the treatment, as we have those microchannels, I put the cream that it contains, the kit contains 2 creams, and there is one cream that I put just during the treatment to make, because it's not necessary to press. When you do this treatment, it's not necessary to press because it has a lot of precision. It's necessary to slide in the skin, and you use a cream that it only contains water. It's not necessary to contain more because it's very important that the broken skin, if you put, it depends on the components, you can have problems. So you have to slide the SkinPen, the device, slide, not press. And then I recommend to put that cream after the treatment several times, and the kit contains another cream that the patient can put 2-3 days after the treatment. Of course, after 2-3 days after the treatment, the patient can do normal life and can feel a little bit the skin a little bit dryness. So if you hydrate very well that skin, it is very important. The first 24 hours, I recommend don't put any cream in the face, only the cream that I give, just to make sure that there are not other components penetrate in the skin, is broken for the microchannels. For me, it's very important. If all my patients do it, this protocol, and honestly, I didn't have problems after these procedures. And if I want to treat damaged skin like wrinkles or acne scars, I prefer to wait 1 month between the sessions. Just only wait 2 weeks if I want to treat dyschromias, because I want to increase the turnover of the keratinocytes. Of course, after the treatment at home, the patient can take care with retinol creams to increase the improvement of the quality of the skin. And here we can see that you can see that it is very important to use the non-dominant hand to open and to strengthen the skin to especially in patients that we want to reach very well this area, and then you can see that we can slide very well with the gel that we put in the face, and we make the movements. The device is very comfortable. It is not heavy, so the staff really thank this kind of device, but because you can move, and when you finish the treatment, you are not feel your arm tired. And here we make the last pass of the round movements. I like to divide it, the face in 4 parts, and I like to treat in 10 centimeters, 10 centimeters, to treat the different bases. So half the face divided in four parts, and we are treating the different areas. Just in this patient, we are going to treat I think that all the face, because we start with this part, and it depends on the person who do the treatment. We can do faster. Do you have more questions? I don't know what can I explain more about the device. Tell me, Andy.
Is on. So if we're treating the neck, what would you recommend as the depth to treat the neck versus the décolleté? Can you explain that a little bit further? Because the neck is more delicate tissue, right?
Yes, the neck is, you have to, there is an interesting, because sometimes it's necessary to remind, and there is an interesting brochure that here you have in the both of Crown Aesthetics, that you have the different depth of the skin, and then you can decide and you can address the correct part. Just in the neck, the depth of the skin is 1 millimeter until 1.25 millimeters. So it depends what would you like to treat. If you want to treat the fine wrinkles and the wrinkles of the collar of Venus, so I recommend to treat 1 millimeter. It depends on the skin. If you have a very thick skin, you can go up to 1 millimeter, 25, just in those cases that they have a very thickness skin. And just in the chest, it is very important, because the chest, of course, you have to measure the skin. There are some patients that they have thick skin and thin skin. Just 1 millimeter it will be enough, but just in those patients that they have a thick skin, you can go until 1.5. You have to take care just for the area around the eyes is 0.25, because it's the thin skin, and the upper arm. This is a very delicate skin, so the thickness in that area, we have to go more shallow.
My question is about the pain. Do you usually use topical anesthesia, or?
Generally, I use a topical anesthetic cream before the treatment, because it makes the treatment more comfortable. If you don't use the cream, it is a little bit discomfort. But if you use the cream, the patient can feel anything, because can feel only the vibration of the device, and it is very, very comfortable. But there are some patients that they don't want to have an aesthetic cream, and they tolerate quite well. But I highly recommend to put an aesthetic, because in these cases it works very well. here we are treating the neck, and
Can we talk about the lip area? How would you treat the lip area? Do you treat on the lips, the vermilion border? What would your settings be on the above the lip or below the lip?
I only treat the upper lip. I don't treat the mucosa. Okay, and so it's the same. Just in those cases that you have a thick skin, sometimes just the upper lip, you have the fine wrinkles that sometimes it's difficult to treat because you need some improve the skin quality. You need to improve the collagen. So I treat this area, and if I have a thick skin, I can go deeper until 0.75, 1 millimeter in those areas, in thicker skin. But I don't treat mucosa. I've never treated mucosa. I don't know. It doesn't make sense, I think, to treat this area. And here you can see that it's quite fast, the treatment. Make the passes. And we put the anesthetic just 30 minutes before the treatment, and the patient feels very comfortable. Just after the treatment, you can see redness. It depends on the patient. For example, if they are smokers, sometimes they have more redness in the skin, but this redness disappears in few hours. The next day, the patients can do just normal life. They can feel a little bit like if they go to the beach and a little bit red, but not too much. It's just normal life. But there are some patients that after the treatment, when we finish, they are very red. Don't worry about it. Sometimes they have this kind of reactions. It depends on the skin, and disappear in few hours. But it's very important to maintain very well hydrated the area that we are treated, and maintain the hydration and drink a lot of water, because we have millions of microchannels in the skin, and we lost a lot of water, especially the first 4 hours after the treatment. It is very important. I give 1 glass of water before the treatment and after the treatment to make sure that at least drink 2 waters in less than 1 hour, and I recommend to do the next 4 hours drink water. And you can combine with other procedures. Just before the treatment, if the patients have retinol skincare, of course, like other aesthetic procedures, I recommend to take it out during 4 or 5 days before the treatment. And I don't recommend to start with retinols until the skin still start to be normal. It depends on the patient's the time of the recovery, but after 3-4 days after the treatment, the patient can feel the skin dryness. It is normal.
How long does it take to do a face, a neck, and a décolleté treatment?
It depends on the person, but it's a treatment that it can take. Of course, if you put the anesthetic 30 minutes before, if in the clinic, and 25 minutes, 30 minutes, we can do the treatment. So if we are talking about the business with this device, it is a device that it is very useful, because it's a device that you don't need to do yourself. You can delegate in a safe. It's a very safe treatment, so your staff can do it without any problem. And if you have your staff very well trained, they can finally know which is the depth and everything. But of course, as a doctor, you can decide where are the depths that we have to put. If you have an echography, you can do an echography and you can evaluate the thick of the skin in those patients. And if you don't have, more or less, if you have experience treating the skins and if you know the different depths, you can do it. And this treatment lasts 30 minutes. And as I explained, the cartridge is only one use. You have to buy the device and then you have to, and you can do the face, neck, and décolleté. This is a very good treatment, and you can charge 300 euros for this treatment. So it's a treatment that, as I told you, is not necessary to do yourself. And just in my personal practice, I can say that I increase my intakes thanks to this. Without losing my time, I can worth my time for other treatments. And this is. You have more questions? Do you use microneedling? Yes. This one. You can go to the stand and you can see and you will see that it is. I use another microneedling, but when I start to use this, it's very ergonomic. You can go to the stand because there are some, and you can try just only to see how it works, and it's not heavy and it's very easy to do. And the more important thing, it is the precision. Because finally, if we are not sure about the precision, finally we'll not have a good result. This is not it is for the device. I think it's important to understand what I want to treat and the precision of the and honestly, it's not necessary to combine the same session with other products, because we are working in non-inflammatory path. Then you can use other things, but you have this option for those patients that you don't need to work in inflammatory.
When they're done in a second, can you set the patient up so we can see what her face looks like in her décolleté? In a second.
Set
Yeah.
up.
Yeah, so we can see what she looks like, because it looks like she's getting nice erythema.
If you can say to the room, just is in front of, because they can hear us. Yes. Can you please sit up the patient?
Can you sit up the patient so we can see how her response is? And could you ask the patient, what does it feel like to her? What does she feel like now that she's done with the treatment? And what's her pain tolerance from 1 to 10?
Can you ask the patient how does she feels during the treatment?
Can anybody read lips? Okay, we'll find out what she thinks. She speaks French only.
She's smiling. I think
there
she's
you go.
saying something good.
Yeah, she looks great. It looks like a mild sunburn, right?
If we are treating deeper for the scars or for the maybe it's a little bit red. Don't worry about it. Yes. With the anesthetic cream, you don't feel anything.
And last question, when can the patient see the result?
Sorry, I forgot this question. I forgot to answer this. It's very important. When we are talking about the stimulation of collagen, I always say that we can see the results after 90 days after the treatment. And it's necessary to do at least 4 treatments, okay? But my experience, my personal experience with myself and with my patients is the final results you can see after 3 months after the first treatment. So it's a treatment that the results takes time. But after the treatment, after the first session, the patients come into the second sessions and say, I can feel a little bit. And they are improving and improving and improving. And I always say one thing, that I say my patients, you need to do at least 4 treatments. If you don't do 4 treatments, don't start these treatments. This is very important. And you have to evaluate the results after 3 months of the last treatment. Because the first, you have an injury, then you have a proliferation of the fibroblast, and then is a remodelation of the skin. For this reason, improve the scars. And just for the melasma, you can see faster because you increase the turnover of keratinocytes every 2 weeks. And they can maintain the results and they don't worsen the melasma even during the summer, and they still improving every day. And also, if you combine with specific creams after at home, they are very happy. Okay, thank you so much for your attention, and I hope it's very useful in your practice. Thank you so much.